They told me when I first stepped into treatment, they said, well, recovery is a process. And I looked at them, I was like, it's a what? My first question was, what's the process? I went back and I started looking up recovery. The working definition of recovery, process of change through which individuals improve their health and wellness, live a self-directed life, striving to reach their full potential. That's recovery.
You know, just for example, let's say I use cocaine, right? You know, I got well has always been a positive statement for you. What does that statement mean in your life?
You remember that shirts that used to say, got milk? Well, yeah. I got well. It means that I don't have to.
All right, welcome to Beyond the Label podcast. I'm excited for our first second time podcast guest, but want to say too, I'm proud. I remember you used to have the Bluetooth with the cell phone right there, and now you're making apps. But I'm just giving you a hard time. But I know a lot of times, technology can be a barrier for people in recovery, simply looking for a job or, getting a good resource. But I got well has always been a positive statement for you in our life. I remember the day we drove to Columbus, and it was kind of like, remember that day we prayed? Yes. I told my wife that story the other day. We were driving somewhere out there. I almost died on this day. She's like, what are you talking about? I was like, man, there was cars on the left, on the right, and you pulled up with that Channel 66 watercolors. Right. I was dying, but we prayed. I didn't realize how bad it was. We didn't make it, but I always remember that training of I got well, and I think a lot of people don't promote recovery in a bad way. Like, there's a lot of shame. It's hard, but for you, what does that statement mean in your life? Not a textbook, but what does I got well mean to David Knauls?
Well, first, I want to say, that was a scary day.
What?
We were driving on ice. We drove on ice from Toledo to Columbus for recovery messaging training. And I'm going to tell you, that really was a scary time. We had to pray. But I got well. What that really means to me, what I got well means to me is that no matter what I'm going through and all the things that I possess wellness. Yeah. I got well. I got it. Some people can have, do you remember that shirts that used to say, got milk? Well, yeah. I got well.
Yeah.
I was ill. It means that I don't have to live with the label of being an addict, alcoholic, junkie, whatever. I don't have to live with that label because I got well. Recognizing what I possess today is important to me. I got that statement. I can't take ownership of coining it. The person that coined it for me was Senator Harold Hughes. Of course, it's also in the Bible.
Yep.
Being well, but Senator Harold Hughes, when he was confronted with saying the term "I recovered," the individuals that were a part of his 12-step group, they said, "Yo, you never recovered. You'll always be recovering." And he said, "Not me. I got well." And when I read that stuck with me. That's right. I got well.
I just thought of something too. It just popped in my head. Sorry to interrupt, but they had. So when I got done with cancer treatment, my doctor at Cleveland Clinic sat down with me, and they had all these scales. And he said, Mr. Spellas, we don't have no research on this. We don't know what's going on, but you got to be careful, right? So tumor was removed. I'm cancer-free, and my wife, they always give me a hard time because one lady who wasn't, a medical provider, she's like, well, you got 5 years to use it over the head. So once they removed the tumor, my wife was like, hey, she always has a hard time saying Joe. She was like, well, technically you don't have cancer. And I said, that's cold-blooded, but the doctor sat down with me. They're like from 30 to 40, you have a 1% chance, and then 40 to 50, you have a 2% chance. And then 59, you have a 60 above 5% chance of any cancer coming back. But in that moment, just like addiction, that recover term, same thing. It doesn't mean that I don't have a risk for cancer coming back. It doesn't mean that I'm cured forever. But in that moment, I'm good. I just have higher risk than anybody else. So same thing with an addict. once they get sober and they're in active addiction, now it just means they're higher risk of a relapse, but doesn't mean like they didn't recover it ever and they're just stuck. I disagree with that sometimes. Like we promote it, but I see that statement. Same thing to other medical diseases where they don't throw it in your face all day long. I can't do this, you just can't slip. So stay away from slippery places. So when you got well, when that statement hit you, how did it project the rest of your recovery and then your professional practice?
It impacted me because it had me looking more so to the recovery aspect of dealing with the problem. So like, it's like I went back and I started looking up recovery. Wanted to know. And then when SAMHSA came out with the working definition of recovery, a process of change through which individuals improve their health and wellness, live a self-directed life, striving to reach their full potential. That's recovery. That is recovery. And so it impacted me and had me start looking more or researching more about what recovery is and how recovery reacts. And you mentioned cancer and how it impacts a person, and then how they measure the longevity. 5 years of being cancer free, they say you're in total remission. Well, it's the same thing with substance use disorder. 5 years of without being actively addicted to that particular drug, your relapse risk rate drops below 15%. Now, why is that important? That's important because 15% is the number of the represents the number of the general population of individuals that have the possibility of becoming addicted to the same thing you were addicted to. In other words, what they say is your brain goes back to normal. It's neuroplastic.
Within 5 years?
Within 5 years, you go back to normal. If you haven't used that drug in 5 years, you're no more susceptible to become addicted to that drug than anybody in the general population. Now, that came from research at the Recovery Research Institute in Boston, Massachusetts. Yeah.
So, just for example, let's say I use cocaine, for example, right? And in that drug, I stop today. But in that 5 years, let's say you do another drug. Does that, I don't know, does that research mean that you did become back an addict, or does it increase your chance to use cocaine, or is it all drugs and alcohol at the same time?
Well, from the study that they did it on different people that were addicted to different things, and they didn't say whether or not that person used another drug in between that time. That particular thing that person was addicted to, 5 year margin, they didn't pick it back. If they didn't pick it back up in that 5 year margin, they were no more susceptible to become addicted to that one thing, than anybody else in the general public. And to me, that's key because it speaks to wellness. And that's, I got well, so it speaks to that wellness, and where a person is not having to identify self-imposed stigma. Self-imposed stigma, calling themselves an addict, that self-imposed stigma allows that allows that person to give themselves an excuse. You shouldn't have did it. You knew I was an addict. You shouldn't have gave it. That gives that person an opportunity to say that. Part of the issue, especially as it related to cocaine, because my daughter, I'm so proud of her accomplishments. Coming out of her vices and having completed something. And I recognize that a lot of people that go to treatment, sometimes they're not allowed to hit their baseline before they're put on medication, and that right there can create another issue. However, we have a way today, like with your agency, a person gets an opportunity to hit the baseline. You know what I mean? They have people that's working with them and talking with them. It's not just trying to put them on something. Because I remember when Suboxone first came out, you was like,
Pissed.
What? Why you want to put them back on that? And so that lets me know that you have a program, like your program is trying to help individuals identify with recovery. And that's why I wanted to contact you about the app, so that way when people that are sitting in your house sitting in your recovery house, or doing downtime.
Yeah.
Instead of scrolling, looking at some of the BS that they used to look at before, they can scroll and learn a little bit more about recovery. They can scroll and learn, hey, case manager, I was looking at this. Is there any way you can, help me understand this a little bit? That gives your case manager something else to work with that person with. And your peer support. Your peer supporter will have an opportunity to gauge that person. Say that person's on going through recovery tolerance, which is step 5, recovery tolerance. Well, what is recovery tolerance? Well, recovery tolerance is managing how you feel when you come in contact or come around people that you may have used to use with. Like, take for instance, say the person that was addicted to alcohol or has an alcoholism problem. He goes to your program, 30 days, he did it 30 days inside, and he goes out, he's got a job, and he starts going to work. He notices he needs gas. When he pull up at the gas station, what does he see? Cold beer sold here. Mm-hmm. That's a trigger. So he has to learn how to tolerate that feeling of wanting to go in there and get a beer before work, because that may have been something that he used to do. So recovery tolerance is important. And if your case manager or the peer supporter or the admin goes into the app, that person gives them permission to look at their progress, and that person, they go in there and they look at that app and they see on number 5, recovery tolerance, they're at a number 4. I would tell the case manager, maybe go with that person to the gas station. When they see that sign says cold beer sold here, process that with them.
In real time.
In real time, absolutely. So the app gives the person personal time to identify some issues, but it also gives your case managers an opportunity to impact them in real time.
Plus, I feel like I don't know if you, like, I've used ChatGPT, but then sometimes I'm like, I get too deep and I'm like, oh shoot, now they really know me, because you get to talk, where I feel like, it's uncomfortable. You got to meet a new person, typically professional. You're in a nice environment. You got to tell them your entire life story. Remind you might have done cocaine in the parking lot. How the hell do you remember all these steps? Plus, you think, to me, I thought everybody was like a probation officer. So when I met a counselor, they're like, I have to report this. I'm like, I'm not telling you nothing, So typically it's not, it's just how it is. Just like, you go see the doctor and, how are you doing? You eating good fried food? No, never. You could just have McDonald's outside. It's not like you do it intentionally. It's just kind of like a fear. And they know that. That's why, just like anesthesia, or something. They tell you don't eat this many hours. But they know the average human not going to do that. Mm-hmm. So I think it's so complex that you might not get the true response. Just like when you do therapy with kids, they have you play with toys. It's not like you're just like, go play with toys, get out. No, you're studying how they move so you get a better insight, But going back, you made a powerful statement. A lot of people get thrown on meds before they reach baseline behavior. That's funny, because today I was joking, and we have a staff here, and there's probably like 5-6 employees there, and we were just joking. And then I didn't realize the MP walked in behind us, and I was like, somebody started like, throw him on Xanax, Adderall, this and that, and I was like, but you see it. I'll see a kid come in from some agencies, and they're on grown-up mental health medications, and I'm not saying people don't need mental health medications, but I don't know how you see some, they have and I've seen it, they have an anger outburst, right? And they might have a grant that has to track psychosis. So what do you know? The first anger outburst might be psychosis. They caught it. But now they're on a med forever with no education, no teach-back method. They don't understand, and I mean, to be fair to doctors, and they're put in a rough situation where they got to fix immediately, and that's the only tool that they have. But, you're supposed to go, this is what they teach you in the books, you go medical, substance abuse, then mental health. And what I mean by that is a patient comes in, sometimes you see this in women a lot more, but they might be depressed, not getting sleep, anything. So what do they do first? Wellbutrin or a depression medication. But in reality, did we get blood work first to see if they have a thyroid problem? This patient might not even be depressed, but we treat them for depression. Now, could they have thyroid and depression? Yes, but then you gotta check, okay, maybe they just got off a bunch of alcohol binge or a drug binge,
Right.
or they're, on something, so it's like you got to rule that out. But I agree with you. Sometimes people throw, and it wasn't that I hated, medical assisted treatment. What I hate is that and still to this day we don't do the strips and all that stuff. But I just feel like they force us on this, and then they tell you, oh, it's a 24-month thing. Why is it 24 months? SAMHSA's research didn't say, hey, just be on these for 24 months. They left out in my opinion, they left out the therapeutic component where they need counseling and stuff like that. So in theory, it sounds great. We're dosing you here, you're getting off, but really it's like a person himself who just got off drugs, hand you a strip, no therapy attached to it. There's no model. They would never do that with any other, like blood pressure medication. They wouldn't say, hey, just take this blood pressure and just come see me in 24 months. No, you have a cuff, you're checking, they're monitoring that. I just felt like at that time, it could be different now. They just, and it goes back to that baseline. They don't even know who you are before they throw you on all this stuff. Every other field, you have blood work done, you have tests, and I understand mental health is different, but it's not, to me it's like a different approach. But you're saying with this new app, I Got Well, they could track in real times triggers that they have, their habits, and in your world, how would the professional take that to help them? Or do they get messages?
So that's a good question, because it's all about recovery management. Because when you get a person that comes into your program, it's not about managing the addiction. They manage the addiction when they're out there hustling and doing all of that. That's managing the addiction. So now that I'm managing my recovery by knocking at your door, the case manager, the person agrees to sign up for the app. Well, there's a free version, and then there's a subscription. The subscription is for the agencies to sign a person up, and they'll receive what do you call that? They'll receive some literary works, some other literary works, personal works that were done associated with the steps that expand different things that they can do. There's a workbook, there's 2 workbooks, and then there's a workbook journal that an individual received. When the agency signs that person up, that person has to agree to the agency being able to see their step progress, being able to see their daily check-in, how they feel every day, see how many days that they have been in the app this week. If they have been in the app at all this week, they have an opportunity to see the analytics associated with all 12 steps. And then I have what I call the SCOPE protocol. And with that SCOPE protocol, it is self-awareness, commitment, openness, progress, and empowerment. So you do that every 45 days. So every 45 days you'll do a scope, and you can't get back into the scope until 45 days has passed. But you do that scope, you're going to be asked a series of questions related to self-awareness, commitment, openness, progress, and empowerment. And each one of those, it's about 25 questions, 5 questions per domain. And when that person goes, the case manager has the opportunity to see how they scaled on that. What their scale is and what they're looking at. So say a person that you're working with, your case manager goes in and see, oh, he scored real low on commitment. That may explain why he's doesn't communicate well in group. It could explain that. It could also explain why he's distanced from the case manager, or he's not committed. Why isn't he committed? Maybe if I find out why he's not committed, and part of that could be trust. So it opens the door for those communication processes. And what helped me stick with the scope, because I've been working with the scope for a couple years now, but I work with an individual on the scope, and people that I work with mental health and addiction, they found that what I related to them about the scope, they was like, yeah, that sounds about right. That's actually right, and that's why I mentioned the commitment, because it was an individual who realized they scored low on commitment, and found out that the reason why is because they had a lack of trust. I can't
with the
commit.
provider.
With providers. They had a lack of trust with providers, and then they didn't have the support with family because they didn't trust family would be supportive of them because they have lied to the family before and said, yeah, well, I ain't gonna use no more, and then they turn around and they use again, and the family said, well, you lied, but they don't realize that that's a part of the condition. The condition of addiction, when a person becomes addicted, from per John Kelly and in the research that was done at the Recovery Research Institute, when a person becomes addicted, there's a 4 to 5 year span where that person is trying to stop on their own.
Wow.
You really try to stop on your own. I went through that process of trying to stop on my own before I tried to reach out for help or even go to mutual aid groups. And so they're looking at addiction as being a process of change that's will probably take about between 5 and 8 years for that person to achieve 1 full year of sustained recovery.
Dang.
That is on average.
Yeah.
That's on average. And so in between that time, you've got 4 or 5 different treatment episodes. But what if they go to that one treatment center, and that one treatment center connects them to recovery? They get to learning about recovery at that one treatment facility, and that case manager gets connected with that person, that person's peer get connected with that person, and they're able to see that person's not going to leave that agency. Why? Because they're supportive of my recovery.
Yep.
They're not trying to always intervene, they're always trying to support. And that's what the recovery management app is about, the I Got Well. It's about providing more access for support for that person so they can put a name to the condition or the problems that they're having. Because, you have a person go in and say, how you feeling today? They mark 4 or 5 different things, right? At one time.
Like the feelings wheel.
Right, on that feeling, 4 or 5 different things. But if you have, like on that app, it'll say, how you feeling today? Are you struggling today? Are you strong today? Are you hopeful today? Those specifics, okay, well, right now, I'm hopeful. Right now, I'm strong. It might change through the course of the day. So if your case manager goes in at 8 o'clock in the morning, this person will be starting group at 8 o'clock, at 9 o'clock. Let me see what they picked out this morning. Okay, on their cab ride, they said they were strong. But when they got in a group, after group, during group, when they went to break, they pushed, I'm struggling. Then maybe we need to change the conversation in group and not so much so talk about the drugs, but talk more so about the recovery from the drugs. Then maybe we need to do that to help this individual out, have them focus more on what they need to do versus focusing on what they have done. Mm-hmm. Because a lot, that's from being involved in groups where, case in point, I had somebody that tell me, I asked them, I said, so what did you get out of group today? What did you learn in group? And they said, dope.
Yeah.
I said, that's what you talked about in group? Yeah, they would talk about dope. I said, so how'd you feel when you left? I wanted to use. What do you think I felt?
You shouldn't. I don't like that where you you reminisce about it.
Yeah.
Like when I ran groups, you slowly hear people. You always inspire me like that to stay professional and that stuff because, before you know it, you learn more. It's kind of like. They call it like some say it's the Department of Corrections, but so the inmates be like, this is the Department of Connections, because a lot of times you learn more about that stuff, especially when it's like a kid. You gotta be very careful. That's what always worries me, like my kids program, like making sure it's short interventions, and I think where we're going with this is like where I think we sometimes navigating our own recovery or whatever that is for someone, we screw up because we forget that treatment is discovery. When you leave is recovery. So a lot of times we're so connected to the field that we forget. Just like if you had a stroke, the lifestyle choices you make afterwards, like do you quit smoking, do you quit eating is bad, or whatever the case is yes, it's important that they put those in place, but you still have to follow when you get out. So I think a lot of people don't get recovery capital. They learn all the stuff there, right? They learn all the stuff in treatment, but then the individual is kind of looking back at the treatment facility like, well, why didn't you do this? But that's where you gain a life outside of treatment to live on your own, because that's the goal, not to.
Right.
To me, I don't like that. Everybody's case is different, but I never want a place where they they depend on us. They just lean on us for professional support because I think and everything's new. This is a new field. Everything changed, but they shouldn't depend. Like, you shouldn't need an IOP group for 24 months. Like I remember seeing though, you shouldn't need PHPs forever and stuff like that. Like the point is to never need that stuff again. So I know we try our best. Like, people come in, it's like 60 days this, 90 days this, 16-week this. In reality, they should progress at their own pace.
Right.
Yes, the professionals have to get, sometimes I'd be in my parking lot and they'd be like, Jake, they know the days of the meetings, all the people get together. I'm not even in these meetings, right? But I get out of the parking lot. They're like, Jake, man, can you believe so and so is? They said I can't leave this group because I got anger problems, right? And they're furious, right? And they'll say, man, I'll a normal person, I'll blow this thing, I'll punch something. I said, hold on, and I try to motivate him, like, how about this? You write down all the coping skills you have not to be this angry again. Then you go to your therapist and you say, hey, let me look at my treatment plan goals, right? And then you beat them. You got to trick the convicts, and you beat them, and you do every single one. You leave here knowing what to do, and then they're like, oh man, I didn't think about that, but it always cracks me up. They're like, can you believe they think I got anger problems? I mean, they're clenching their fists. This is 7 a.m. And I don't even know, I don't even know this individual. They just know, and they're ready to fight, and I'm thinking like, yeah, you got anger problems. Do you think we're making this up? They're just scared to tell you.
Man.
But I think that's so true because a lot of family members, and like it doesn't make sense in addiction, they do everything right. A mom, dad, support, whatever. But I don't think the addict mindset, I'm sorry, I don't think the recovery mindset is stuck like, I'm gonna do this and use automatically. It's like a series, it's a series of events, just like there's high risk for blood pressure and all these things, families, whatever. Same thing with the addiction where it kind of just happens, like a relapse. You don't leave somewhere like, I'm gonna relapse, I'm gonna do this stuff. It just happens. But with your app, they can communicate with themselves and the provider, so you have all hands on deck looking at that. What have you seen work the best now? Is it the scaling? Is it the actual the psychology behind like telling a secret to something, like to somebody else? What has been the most useful?
The most useful has been identifying what it is. What the solution is, identifying what the solution is. That has been the key for a lot of the individuals that I've talked to. Because I go down there to Cherry Street Mission. I'm at the Cherry Street Mission every Thursday from 1 to 2:30. And identifying. They're not being able to identify what recovery is for themselves, not even being able to identify what pathway they want to take. And in the app, you have secular, religious, or spiritual. Which one of these is where you want to? Which one of these you want to find your identity in? Because recovery is about recovering who you are, finding your identity, and realizing who you are. Because the first 3 steps of recovery management: recognition, vulnerability, and identity.
Wow.
Those first three steps is what's crucial for a person to recover their life. First, you got to be willing to acknowledge that, hey, I got a medical condition and my life became unmanageable. 2, vulnerability. I have to be vulnerable enough to share the care of my health with somebody else in order to get the support that I need. 3, once I get the support that I need to start identifying what pathway I want to take. Who am I? I need to identify who I am, because when I get in treatment, if I don't work on my identity, somebody else going to define it for me. And that generally happens. And I've also learned that some people, once they get in there, they're looking to try to find the support to help them identify themselves. Well, here's this opportunity. Me being a spiritual person, I believe in God. I believe in the Lord, and I do a 7 at 7 every morning. I do a 7 at 7, and it's a spiritual hope filled, scripture filled push for individuals, hoping people get there. You know, whatever it is that's holding you back today. You know, I'm going to give you some inspiration going out the door in the morning. You know, in the morning. So, but what I found, like I said, it's just that identity piece that has been really helpful, helping them identify what recovery is. Like I said, you know, going through the definition, because when people don't know the definition of what they're trying to get to, that's a problem. If you tell me that, what I remember when I first stepped into recovery, and they told me when I first stepped into treatment, they said well, recovery is a process. Yeah. And I looked at them, I was like, it's a what? They said it's a process. My first question was, what's a process? What is a process? You tell me that's what it is, but what is a process? And so I looked it up. It's a series of events that must take place in order to achieve a desired form or standard. Yeah. So if recovery is a process, then there's some things that I got to go through in order to get the end result. Yeah. And if relapse can happen in recovery, when am I not in recovery? That's exactly where it happened. So address my relapse and my recovery. And I'll close with this. I remember when I left when I was at Empower for Excellence, it was that this lady, one of the case managers called me about 2 weeks after I was gone. I was working for the health insurance company at that time. And I believe that God took me on that journey to learn how it works on the back end. So that way I can say this app that I have, I forgot to tell you, that's the most important part for agencies. The app that I have, you can identify key performance indicators to give the insurance company so that they'll know that your company is doing what it's supposed to do. Because I have key performance indicators that are listed out, and I can put them on a fishbone for you so that you can go through and say, oh, this program is actually working for this person. We're going to be seeing the results that we're looking for by paying for their services. Mm-hmm. But the lady called me and she said, I had this person, they left treatment and they graduated and they went to aftercare, and now all of a sudden they disappeared for a week and a half, and then they called me and told me that they used. What should I do? I said, okay, well, let's back up. So they completed treatment, right? Yeah, they completed treatment. Then they went, they were in aftercare. They came to the first couple aftercare classes. Then all of a sudden they went and they relapsed. I said, no, back up. That's not what they said they did. Yeah. They said they used. Well, it's the same thing. No, it's not. Because relapse, they would not be knocking back at your door. Right. If they relapsed, they would still be out there. Yeah. So just look at what happened. They used. So because they used, what do you think you should do? Well, I think I should put them back in partial hospitalization. I said, why would you do that?
Yeah, they wouldn't qualify.
So, well, because they're on drugs now. I said, no. They told you that they use drugs. So you wouldn't put them back in partial hospitalization. I said, why would you put them back in partial hospitalization? And that's not where the problem happened at. Mm-hmm. See, the problem didn't happen in treatment. It happened post-treatment. So you address the problem post-treatment, that keeps them connected to the treatment. And if you allow them to continue telling you what's going on, you can help them manage their recovery. Yeah. Because if you bring them back, when they get to the spot again, what you think is going to happen? Yeah. Because you didn't deal with it. Yeah. So that, that learning the recovery management and how we could help people post-treatment, keeping them connected to this treatment agency instead of all this hopping around. Keep them connected to the treatment agency that they've identified, and then now that they're connected to the treatment agency through access through an app, the treatment agency is able to work with them and help them learn to manage their recovery versus continuing to intervene on their drug use. Because that's what we do. When we do an intervention, we're intervening on their drug use. Why do you think they go back out and use the first chance they get? Because you intervened on what I was doing.
That's the whole thing. I used to think like that too. Yeah, I used to tell the patient, they'd be mad, especially when I started, they'd be like, Jake, you were right. I said, what? They said, man, you said you would mess my high up. I was like, what you talking about? They said, I got high and all I could think of these stupid sayings you were saying. I said, oh yeah, I won't stop you, but I'm gonna mess it up though. You're gonna be that Motel 6, like, damn it, he told me if I did this, But yeah, I think, what I see it wrong too. There's a lot of people have like, in the field, they have like this authority, like figure type complex where it's like, I went through this, so you should be able to tell my story. You should take my story and inspire you. But you and me both know there's internal and external motivation. Mm-hmm. So we read stuff every day, and I'm like, wow, that's really cool. Like how many people they see some food on TikTok and they send that recipe, but they never do it. So that inspire you to eat healthy and do this stuff, but you never did it. You know. So I think in our field, you know, I would never get a surgery. Like I just had a hernia surgery, right? I never went to that guy and I'm like, hey, doc, you've had hernias, right? You had a bunch of them, right? You had one this big. How the hell you get over it? No. He was a medical professional. But I think sometimes in the field's growing and stuff, there'll be a lot of stuff coming. But, you know, we shouldn't teach from authority. We should teach from professionalism when it works. And I got into that same argument with some staff, too. They said, oh, no, it's a full relapse. I said, it's a lapse. And they pulled out the Google, right? Mm-hmm. Like I just made this term up before, right? Like I just came up with it, you know, and they're like, oh, that's not how it works, you know, they'll have to. And I see the point behind it, but I don't like when somebody has one mistake or they didn't mean to, and then they got to walk in front of everybody, kind of like the walk of shame, you know, and they say, oh, we're not judging. They judge, and like, man, I knew his ass was going to, and then they go start from day one again. But we never lose that information, nope. You know, but we got to learn what not to do and what to do, mm-hmm. You know, and I think documenting that, or at least talking to somebody, because it's impossible for a treatment place to have access to you 24/7, and it's not healthy because they got to learn how to live without mm-hmm. that professional too. Mm-hmm. You know, mm-hmm. Eventually you should be treatment free. Not saying people don't need counseling or people don't need medication management. Not saying that at all, but we shouldn't be dependent on that, because I think that I want to say it freely, kind of becomes worse to the individual if they got to depend on that place. Because, you know, there's that scary moment when you leave treatment where you're like, you know, I don't know if I can do it on my own. But that's where you build your recovery capital to sustain without it. Because that's our medical goal. We should get you to function without us, you know. And, you know, don't take it too far and stuff. But I like where a lot of things are going with technology. Mm-hmm. You know, I feel like our field, the behavioral health, has made some progress. But we're also very slow to adapt to some of these changes, you know, like mm-hmm. back in the day, you're right. Some of these places like force you to be 90 days here, but you know, I've worked with patients, sad cases that prison made them have so much trauma and PTSD, and they might have had schizophrenia too in their voices. So we throw them into a dark room, people sharing, you know, these novelty, good stories, but they're panicking and they're scared. And you know, what we say is they're not ready. You know, it's not that they're not ready, it just wasn't the right environment. So why isn't there a plan where, and I don't have the perfect answers either, you know, why isn't there a plan where they could get individual attention and still have that high level of needs, but be included in that too. So, mm-hmm. you know, I love the, you know, I got well statement. I think it used to crack me up. There'd be big billboards. It's normally like, you know what I mean, like scrawny white kids just in a bar with a flashlight on them or something. Like, man, this you know, this is what happens. You know, or we see the train. You know, they're like, man, this guy had all these drug bags. You know, and they pooped him out. You know, and you know, nobody's seen those billboards and just stopped and been like, you know what? I'm going to pull this needle on my arm and go get sober right now, you know? Right. But in our mind, we can't scare our way out of this addiction. To me, we got to love the way out of the addiction, you know? Go ahead.
See, got it. That right there is the key. That's key. Because I know that right there is key. In 1841, John Hawkins said when he came home, people would bring him home drunk. He would have 4 or 5 tumblers, and that's like a 40 ounce, 4 or 5 40 ounces.
That's what you had back in the day? No,
he said people would bring him home and lay him in the foyer. His people would get him and bring him back, and they would love him through his recovery. That's key. We push people away. I never met a mother or a father or an auntie or a brother or sister that said, I'm glad I got my stuff, even though my child is dead.
Damn.
Or my son is dead, or my brother is dead, but at least I still got my stuff that I was protecting from him. No, they would rather let that stuff go to have that life back.
Yeah.
Why do you think we have the angel walks and chalk the walk and all that? Because people are missing their loved ones because they were told to let them go. What do they say? You're enabling them. With or without you, they will do it.
Yeah.
But you have the choice whether or not you want to care for them through their recovery. And I think that we have to care more for people, like you said, through love. Love them back to health. You don't, you with what you suffered with, who hurt you back to health? Who beat you down and told you that you can't come around until that's gone?
Yeah.
You know, but we do that because of the result of that drug addiction. And sometimes mental health, it comes with some scary vices that people have. And because they're scary vices, we've been taught to push people away and don't, quote unquote, enable them. But sometimes you enable them more when you push them away, because now you put their care in the hands of somebody that really don't love them like you do.
Oh, yeah.
You know?
I hear it every day, you know. I see it every day,
Yeah.
you know, in some sense. But I appreciate you coming in. You know, how can an individual or agency maybe download this app or get started?
What they would need to do is they would need to reach out to David Knowles. Reach out to me, d.knowles@igotwell.org.
That's sweet.
Say it again, d.knowles@igotwell.org. The reason why I said it is because something happened to the website on the back end, and otherwise they can go to my website and get it. But right now the website is down. So right now just email me, d.knowles@igotwell.org. It's also who also has it, the Mental Health Recovery Services Board. They have
Sweet.
They have it. Cherry Street Mission, they have it. The Thomas Werner Center, they have access to that information as well. I'm just really trying to get recovery to be a part of the growth for the people that we serve in the community.
All right. I appreciate you. Thank you so much.
Thank you. I appreciate you having me. And before you go, I'm always proud of you. I love you like a brother, man. And I'm always proud of the work that you're doing. Keep it up.
Thank you. Appreciate you.
Appreciate you.